Hello and welcome back to another episode of M.I.N.O.R Talk. I'm Josephine and I'll be your moderator for today. In today's episode, we'll be diving deeper into a syndrome that is quite common among women, which is Polycystic Ovary Syndrome, also known as PCOS. Without further ado, let us welcome Dr. Yong Jee Kien. So before we begin, Doctor, could you briefly tell us about yourself?
Yeah, I'm an obstetrician and gynecologist, presently working in a private hospital at Thomson Hospital Kota Damansara.
Okay, yeah, great to have you here with us, Doctor. So shall we proceed?
Yeah, sure, please.
Okay, so all right. So many students do not actually know what exactly is PCOS. So could you please briefly explain this syndrome?
Yeah, sure. Basically, polycystic ovarian syndrome means is a condition which affects women in the reproductive age group, basically. And women with this condition will present with irregular periods. Okay, let me clarify what is irregular period. Those with women who are not having their regular menstruation, like every 28 to 32 days, are considered irregular. For example, they have periods like one in 2 months, 3 months. Okay, those are considered irregular periods. So I've seen patients who have irregular periods with a delayed menstruation for up to 1 year. Okay, these are all abnormal. So the other condition, the other symptoms that they may have is they may be overweight, okay, more than their normal BMI, body mass index. And also they could have increase in their testosterone level, causing hyperandrogenism. So they will present with increase in acne and then hair growth, okay? And basically, that's what the patients with PCOS will have, basically the irregular menses. The other one is overweight and then hyperandrogenism, which means they have increase in the testosterone, causing them to have acne, increase in acne, increase of hair growth. Basically, that's it.
Okay, I think that's very interesting information. So my next question for you is, how would one actually be able to identify whether or not she has PCOS?
Okay, basically, normally, how would patients with polycystic ovarian syndrome presents to a gynecologist? Okay, so you can present either to a gynecologist or you can present to an endocrinologist or a physician for that matter. Like they may have diabetes and all that, but from my perspective, as a gynecological point of view, they will present with irregular periods. Okay, lots of patients, actually half of them will present with irregular periods, and there are some of them, up to a third of them, may have problems with conceiving. They may have problem conceiving because of their irregular periods. The reason why they have irregular periods is because of anovulation. That means they're not ovulating every month. As you know, women with regular periods will means that they will have regular ovulation. If a woman ovulates regularly, that means their periods are very regular, between 28 to 32 days. If they don't ovulate, then their periods can be delayed or becomes irregular. That's how they usually present. Okay, from the history-wise, they will present with irregular periods, and then when you dig deeper into the history, they will have the next thing that you look for is actually the increase in testosterone secretion. That means you will be looking for signs of hirsutism. They may be obese, overweight, and the other thing is acne. That's from the history. Then after taking the thorough history, then you will go on to do a physical examination where, as I mentioned earlier, you'll be looking for signs of the hyperandrogenism, like increase in hair growth, or we call it hirsutism around the face and the body. And then you look for an increase in the acne. Then they are obese, and usually this obesity is centrally located. And basically that's it. And then for us gynecologists, then we would normally do a ultrasound. Okay. So an ultrasound is basically to look at the uterus for any abnormality, not just to look for polycystic ovaries, to look for any abnormalities like growth in the uterus, like fibroid, a uterine fibroid, because they present with fertility. So we have to look for all these. And in the endometrium, we look for any signs of endometrial polyps. Then after that, I'll be looking at both ovaries. Okay, the diagnostic criteria is to look for an enlarged ovary. Okay, with lots of small follicle, immature follicles. That means when we do a scan and look at the ovary, when we look at the ovary, we'll look for these follicles. Those follicles, the sizes are ranging from 2 millimeter to 9 millimeter. If according to the old criteria, the Rotterdam criteria, you will have more than 12 follicles per ovary, those between the size of 2 millimeter to 9 millimeter. But with more recent radiological consensus, now they don't no longer talk about more than 12 follicles per ovary. They are talking about more than 20 follicles, those small follicles between 2 to 9 millimeter of more than 20 per ovary, and these will meet the criteria to call these ovaries polycystic ovary. So basically, that's how I come to a diagnosis of polycystic ovary. I seldom do a blood test. Okay, if I want to do a blood test, normally if they present with those cases who have very irregular periods, like more than 3 months, maybe I would consider doing a blood test. When I do a blood test, it's basically to look at their hormonal levels. Basically, the blood test that I will be doing is the follicular stimulating hormone, luteinizing hormone, and the prolactin level. Up to about 30% of polycystic ovarian syndrome patients will have an increase in their prolactin level. Okay. Of course, I also look at the FSH over LH ratio. Normally, in the normal women who are menstruating regularly, the FSH will usually be higher than the LH. But in patients with polycystic ovaries, they will have a reverse. It means the LH is higher than the FSH. That means the LH and FSH ratio is more than 2:1. That's where we would classify them as polycystic ovaries.
Okay. I think it's quite interesting to like figure out how to actually differentiate whether you get just an irregular period or like you actually have PCOS. And I think, doctor, you've already covered my next question, which was how is PCOS usually diagnosed? So I think
Yeah.
I'll just move on to the next question, which is like, what would the treatment plan usually be if one were to be diagnosed with PCOS?
Okay, basically the treatment option or the treatment plan will depend on what the patient wants. As I said, most of these patients actually come to me because they are not able to conceive. Okay, not because of their menstruation problem like delayed periods. They are more concerned of their fertility. Okay, if they wish to conceive, then my treatment will gear towards helping them to achieve a pregnancy. And as you know, patients with polycystic ovary, they have an ovulation. That means they are not ovulating every month. Then my treatment will be basically to help them to achieve ovulation. That means I'll be using ovulation induction medications. And the easiest one is, of course, the famous clomiphene citrate. Yeah, I use lots of clomiphene in patients with polycystic ovaries who have got an ovulation. Okay, that's if they desire to have a baby. Okay, if they do not desire to have a baby, okay, then the next step will be to achieve regular menstruation. Okay, this can basically be achieved through the use of lifestyle modification. Okay, ask them, as I said, most of them will be overweight or obese, then I will ask them to lose weight. Because if you can lose up to 5 to 10%, most of them will have regular menstruation with these simple measures. Okay, this can only be achieved through healthy lifestyle like exercise, cardiovascular exercise like riding a bicycle or jogging, go for your jogging or walking. Okay. And the other one is, of course, dietary control, like they have to control their diet, control to reduce their fatty foods, reduce their carbohydrate intake, and just follow the WHO recommendation. Basically, I think that's what I would, that's how I would treat my patients.
Okay, I think that's interesting information regarding the treatment plan. So the last
Yeah.
question would be, I think you covered this a little bit also, but like from the perspective of a gynecologist, what advice would you give to women who have been diagnosed with PCOS? Like given that their physical appearance will be affected, like psychology or physically.
When they present, usually they have irregular periods, they are obese, and then they are infertile. Normally, I would ask them to lose weight, change their diet into a more healthy eating habits, less carbohydrate, less fatty food, more vegetables, and then exercise. Exercise is very important. Okay, sedentary also leads to sedentary lifestyle leads to obesity and overweight. So exercise helps to burn some fat and help them to lose their weight. And if they are trying to achieve or even if they are not trying to achieve a pregnancy, I would advise them to start a family early and not wait until they are 40. It's basically how I would approach patients.
I think that's some great advice, Doctor. So I think that sums up our interview session for today. So thank you so much again, Dr. Yong, for joining us today and giving us insight regarding PCOS. I've definitely learned a lot from this session. So thank you everyone for listening to this episode of M.I.N.O.R. Talk. Stay tuned for our next episode. Bye.
Bye-bye. Thank you.